Right, so we are recording and the event is go. So thank you for attending, everyone. This is a talk on the film, or a talk after the film, The Great NHS Heist, with the maker of that film, Dr Bob Gill. Hopefully everybody's seen the film and they know how impactful that film is. Starting from the inception of the NHS and how good it was, through to Mrs Thatcher's government and the initial plans for privatisation, through to Tony Blair, through to the coalition government, through to what's going on now. So what I'll do now is I'll hand you over to Dr Gill, who will make his presentation. During the presentation, if you could direct your questions to Mina, and she'll pick out some questions, ask a question anytime, but we'll also have time for questions afterwards. So without further ado, I will hand you over to Dr. Gill. You're muted.
Sorry about that. Thank you, Jeremy, for that introduction, and thank you for inviting me to speak to your group today. What I'm hoping to do in the next 15-20 minutes is outline what's happened to the NHS very briefly for people who haven't seen the film, describe how the NHS was before the pandemic, and what the government is currently doing under the cover of the pandemic, whilst the NHS has never been busier and struggling to cope, is providing perfect cover for accelerating the privatisation. So to recap, the NHS was a revolutionary act by our governments to significantly improve the welfare and life chances of the population. And they embarked on a new system, the Beveridge model, which decided that the best way to provide healthcare was to make it universal, comprehensive, and fund it through general taxation. Now, this type of system was the cheapest to administer and included the whole population. Naturally, it removed the worry of sickness from working class people who often went without getting care. And we've been in a 40-year transition to totally reverse the progress that was made after the war. So the social contract agreed in peacetime has been torn asunder, and the last part standing has been the NHS. The hardest one to dismantle without there being a revolution was the NHS. But they've managed to do it by stealth. They followed a plan most clearly outlined by Oliver Letwin in 1988 with his co-authored pamphlet called Britain's Biggest Enterprise, where he sets out how to do this by stealth, by introducing a bloated market bureaucracy, molding the ethos away from public service into a business ethos, outsourcing to start off with non-clinical activity, then clinical activity, and eventually entering into public-private partnerships, which will shift control to the private sector. One example that we should all know about is Private Finance Initiative, which under Blair managed to, yes, we got new hospitals, but all those hospitals were much smaller than the ones they replaced. So in fact, it was the NHS's biggest bed closure program. The ownership of those hospitals doesn't lie with the public. The ownership is with private financial corporations. And we are paying a rent for 30 years, at the end of which we don't own anything. It's not even a mortgage. And the cost of that deal will be paying 7 or 8 times what we borrowed. Now, I don't think many of us would get a mortgage on those terms, would we? A mortgage that you end up without the asset. So that's an example of a public-private partnership. The public takes the risk and pays the bill, and the private extract the profit. What a wonderful partnership. And you may have heard about what happened in Parliament yesterday. They voted through a significant piece of legislation which builds on and progresses what happened in 2012. Now, in 2012, the Health and Social Care Act, in effect, in law, abolished the NHS. It removed the duty of the Secretary of State to provide healthcare. Now, not many people are aware of that. And since 2012, even before, since the financial crash, there has been a program of defunding the NHS. So the historic funding rise for the NHS since 1948 has been about 4%. Since 2010, it averaged 1%. So a real terms shrinkage of 3% per year. That's gone on for a decade. And there's been a major bed closure program. So we've lost 17,000 beds since 2010. And 100 A&Es, over 100 A&Es across the country have been closed or downsized and turned into urgent care centres. So we have a massive contraction of public provision. We have a defunding program, and the end result of that was to leave the NHS on its knees by the end of 2019 before the pandemic struck. The NHS was already on its knees. Deficient of 100,000 staff, 10,000 doctors, 40,000 nurses, waiting lists already approaching 5 million. Now we've passed the 5 million number, but it was already getting to historically high figures. And then we had the pandemic. But you might wonder, well, we were the pioneers. This country pioneered public health. Surely we have a public health system ready and up and running, ready to go. No, that was dismantled in 2012. They shut many public health labs. They sacked a lot of the organizational experience and memory within the public health system. And they dumbed down provision. You didn't have to be a doctor to be a director of public health, and transferred responsibility to local authorities. So a major de-skilling and a major shedding of organizational memory and expertise, and closure of labs. So when we entered the pandemic, public health was decimated. The system to stockpile emergency equipment had also been outsourced. NHS logistics was privatized. The stockpile centers had changed hands 3 times from one private provider to the next. And we know the result of that was the NHS didn't have enough equipment. And we have the second highest death toll of health and social care professionals in the world per head of population as a result. We have, per head of population again, one of the worst death rates from the pandemic. We have had a catastrophic and hugely expensive response to the pandemic, which, as we all know, the government pursued and are starting to re-pursue a herd immunity strategy, which meant that they were quite happy for tens, if not hundreds of thousands of people to die. That is our government in a democracy willing to sacrifice such a large number of people. Now that is where we are. That is the mindset of the people in power at the moment and in the past. So where are we heading? Behind the scenes, since the mid-2000s, corporations such as United Health, America's biggest private insurer, such as the big 4 accountancy firms and the management consultancy firms like Deloitte and McKinsey in particular, they have been embedded in the backroom contracting and financing mechanisms of the NHS for over a decade already. They have their hands on all the levers of power already. This is not some sort of hypothetical threat a few years down the line. Now, what we're seeing playing out in Parliament this week is the putting those arrangements on a firm legal standing. It's been going on in shadow form for all this time. So this is no hypothetical threat. And what the new bill will do, it will do several things. The important things, it will create a new legal entity called an integrated care system. Lovely title, but it has nothing to do with integration of care. What it will do is denationalize the NHS into 42 ICSs, integrated care systems, which will have their own budget, a fixed budget, out of which they will be able to take a profit. Let me repeat that. A fixed budget that they'll be able to take a profit out of. And it will be dominated by these firms that have already been there for over a decade, such as United Health, a private insurer. Now, the creation of these new entities, the name has changed, but it has been known by various things, and they are all a version of what exists in America. These were first called health maintenance organizations, then they became accountable care organizations in America. They tried to use that name in this country, had a bit of pushback, so they've changed the name, and now we have integrated care systems. But to understand what it is, it's a mechanism whereby providers and insurers who are controlling the budgets collude to deny patients care to make a profit. You have providers and insurers or whoever's controlling the budget colluding against the interest of the sick. So these people on the ICS boards, United Health, and in this country, their subsidiary is Optum. Now, we've done some research on this. We're hoping to get published. But Optum have been awarded contracts that we're aware of in excess of £17 million, doesn't sound a lot, for training leaders within the NHS and leaders within local authorities. So we have a pretty sophisticated brainwashing program, which has been in place for years to mold the leadership to carry out American healthcare in this country. Now, in order to achieve the pulling off of United Health Optum controlling the whole budgets for the NHS across 42 integrated care systems, they need to remove a convenient bit of legislation from the Health and Social Care Act. And this is known as Section 75. This compelled the contracting to be open and competitive. Now, none of us, I'm sure, listening to me at the moment, wants any competitive tendering. But if it's going to happen, it needs to happen in an open and accountable way. But they want to remove that because that's no longer convenient. And what they want to do is what they did through the pandemic, which is the awarding of multi-billion pound contracts for 15 to 20 years to private corporations without any public scrutiny. So they will normalize the awarding of crony contracts that we've seen with PPE and probably most spectacularly with Deloitte, Serco, NHS Test and Trace. There is nothing NHS about the test and trace system. In fact, the Parliamentary Public Accounts Committee said the 22 billion spent on this outsourced fiasco had failed to have any demonstrable effect on the spread of the pandemic or the need for economically and socially devastating lockdowns. Now, this is the blatant looting of the treasury and without any quality and delivery of service that it wants to turn the rest of the NHS into by this legislation that's going through. What else would the bill do? Well, the bill is proposing to deregulate having professionally qualified people delivering healthcare. This is called de-skilling and task shifting. That's another way of maximizing profit. So you can do it by denying the sick and expensive patients care, and you can do it by employing the cheapest, least qualified staff and eroding, destroying their terms and conditions and exploiting them to the maximum. That's what the bill achieves. It will destroy national bargaining. It will destroy protections on minimal staffing levels and remove the need for qualifications to do medical work. Now you can imagine the impact on the individual staff members. We've seen it through the pandemic. We've seen on ITUs where they've had to expand the capacity within the NHS. We've seen experienced ITU nurses who gave one-to-one care for the seriously sick being overstretched and having to deal with 6 patients at a time. And the people they couldn't get to were being looked after by untrained healthcare assistants. Now, the government see this as a success, but I'm sure the people who died through lack of qualified attention don't see this as a success. So this is where we're going. It's quite a dystopian scenario. Just to return to America again. So America spends more than double if you add up public and private funding that goes into the American system, more than double per capita than we do in this country. Yet it has worse outcomes. So they have a lower they have a lower life expectancy, they have higher infant mortality, higher maternal mortality. Now, these are hard indicators of how good a health system is. So despite spending more than double, we do. The cost of running the NHS in terms of administration before Thatcher came to office was estimated to be about 5%, the cheapest administrative cost of any health system. In fact, no health system in the world, which is privately run, can deliver universal health care. They don't do it. That's not the business model. So it spends twice as much, worse outcomes, and the market is not interested in the elderly or the poor. So what happens in America? The taxpayer steps in through 2 systems called Medicare and Medicaid. The taxpayer picks up the bill. Now, up until recently, the government administered this funds. But in the recent years, United Health, led by Simon Stevens, who is currently the chief executive of NHS England, he persuaded government to hand the control of that public money to United Health. Now, the similarity with this country is we have an NHS which covers everybody, but Simon Stevens and United Health Optum have persuaded the government to hand all budget control to them, as they did successfully in America. So the NHS will become a version of Medicare covering everybody in this country. And in charge of the money and the funding flows, you have these parasitic organizations whose business interest is to prevent money being spent on the patients. In fact, when they do their quarterly reporting, they have what's called a loss ratio. Loss ratio to me and you means money spent on medical care. So the figures they report to Wall Street, if they've spent too much money on patients, the share price goes down. And don't forget the chief executive's bonus is determined largely on the share price. So all the incentives for the people running United Health Optum in this country will be to maximize profit through the denial of care. And they're getting very sophisticated. How will they deny the care? Well, getting a human being with compassion to decide on how to deny care, that's sort of old fashioned. What they're going to do now is have access to all your medical records and your social care records and use algorithms and various other computer mechanisms to risk stratify and to decide, to guess, to predict who will be expensive, and those patients will be denied care. So you will have a computer algorithm, not your GP and not your consultant, deciding you deserve treatment. They're taking the human factor out of this. So you will have not only the individual level denial of care, but you will have an ICS system-wide freedom for the board to decide on an individual ICS basis that they no longer want to provide a certain service. For example, cataract surgery. So they, in one particular ICS, let's say covering Ealing, the board might decide, well, you know, we don't want to do cataract surgery, so we're going to ban cataract surgery for every patient in our ICS. So you have a postcode lottery, a deadly postcode lottery, an individual algorithmic decided decision-making tool to deny you care. And then, of course, you've got the blatant tool of shutting down your facilities. So you've got nowhere to go. If you're seriously ill and you need an A&E, and you used to go to Ealing Hospital A&E, well, now you have to travel further. I don't know where your nearest A&E is anymore, but we know that for every minute delay in a seriously ill person getting A&E expert attention increases their chance of mortality. Well, you can see what will happen. Now, if that wasn't bad enough, they have a new telephone system called 111 First, which in future you will have to ring to get permission to attend A&E. So you can see I've listed a multitude of barriers that are already in place and have already been operating in shadow form, although have not been given legislative approval. And that's what this bill does. Let me give you some examples because it's all very technical what I've told you so far. A patient of mine presented to Queen Mary's Urgent Care Centre, which is down the road from my surgery. She was had severe abdominal pain. Now remember, this used to have a full-blown A&E with surgical speciality on site and urgent medical, surgical, obstetric and gynecological services based there. But they lost their A&E, they lost their acute bed. So now we have an urgent care centre. Patient turns up, driven there by her husband, in severe abdominal pain. This patient had a history of circulatory problems. She had what was called intermittent claudication, which means not enough blood flowing to her legs. She had high blood pressure and she had been a smoker. Now, somebody with those that past medical history presenting to an acute medical facility with abdominal pain, one of the diagnoses that should be high on the list is an aneurysm, because aneurysms, aortic aneurysms, are associated with poor circulation. Now, the junior doctor who saw this lady didn't have any senior backup. There's no surgical backup there. He said, I don't know what's going on, but can you kindly make your own way in your own car to the A&E, which is 20 minutes down the road? So they did as they were told. Within a few minutes of leaving the urgent care department, she collapsed in her own car. An ambulance had to be called. She had a ruptured aortic aneurysm. Now, this is after several hours delay waiting to be seen in the urgent care center, then the significance of her illness not being diagnosed, and then to send to another hospital which wasn't equipped to deal with the aneurysm. She eventually got to King's, where she had open abdominal surgery, which went on for hours. Her life was saved, but then she spent a torrid time on an intensive care unit. After a few months, she died. Now, this is a tragedy on a personal level. She has left behind a devastated husband. She has cost the NHS as a result of failing to pick this up earlier, where it could have been treated more safely and she could have recovered. a huge expense running into the hundreds of thousands because she had to be maintained on an ITU for months and required several operations, because dealing with somebody after a perforation is a lot more deadly and expensive than picking it up before it pops. That's what happened to her. Why did that happen? Because the person she saw wasn't experienced enough. This is what happens when you downskill and do not provide backup. The person you see has a bigger blind spot, less experience, unknown unknowns. And that's an example. These are just one example of many patients of mine who have suffered preventable harm and unfortunately death in several cases as a result of what has been happening. The closure of services, the contraction of the NHS, and the de-skilling agenda that's taken place. The other thing we need to appreciate from America is not only is it a totally dysfunctional system, it introduces perverse incentives whereby it's in the provider's interest to over-investigate and overcharge. It's in the insurer's interest not to pay out, and the patient is stuck in the middle when they're in their most vulnerable state. This is not a good system. This is a terrible system. Also endemic in that is when you set up financial incentives in such a way, it is rife with fraud, double billing, denial of payment. Somebody estimated, I think, I forget the name of the author of this report, but estimated that 10% of every dollar spent in American healthcare is lost in fraud. Now, on top of that, if you take out the 30% that goes in the overheads, that is the billing, the administration, the chasing up for bills, the lawyers' fees, the accountancy fees, the executive bonuses, and shareholder dividend, 1 in every $3 spent on American healthcare goes out on administration, 10% in fraud, and they have worse outcomes. And this is the system our politicians of all persuasions have chosen to copy. So what will we be left in? We'll be left with a service decimated of expertise, running at full stretch to provide substandard care, with demoralized, demotivated, and emotionally drained and psychologically scarred staff. And who will be leading this? It will be led by people who never see a patient, lack compassion, lack empathy, probably on the sociopathic end of the spectrum in terms of personality, who will be handsomely rewarded financially for all the devastation that they are supervised. And just a word about general practice. So I'm a GP. I have refused to undertake quite a lot of activity that my clinical commissioning group was wanting me to take up. There was finances attached to it. For example, implementing an electronic appointment system, e-consultation. I don't know whether any of you are familiar with this. And in order, we were incentivized to install these things, and we were told this would improve patient access. But what it has in fact done, it has massively increased the workload of GPs, often dealing with frivolous or duplicating activity. And that's why you can't get in to see your GP. That's one reason. The other reason is, over years, they have chipped away at continuity of care. So if you attempt to see the same doctor on 2 consecutive occasions, it's next to impossible. But if you compare to what things were like 10, 20 years ago, continuity of care was a cornerstone of general practice. But in 2003-4, a new contract was introduced for GPs, which took away the need for a doctor to see patients. You could still earn an income by outsourcing your clinical activity to salary doctors who you could exploit and pay 70 to 80% of the income that you were taking. And if you do that 3 or 4 times, you can extract a full GP salary or income without ever seeing a patient. Now, these are the GPs who are leading and sitting on the boards of the clinical commissioning groups. GPs like this gathered together and formed AT Medics, which you may know recently sold out 49 surgeries to an American insurance company, Centene. Now, we can focus on Centene if you like, but you need to understand what has gone on for the 15 years preceding the takeover by Centene. GPs have been exploiting the legislation, the creation of what were called alternative medical practitioners, different types of surgery, contractual arrangements. They have exploited that. So we have given away the high moral ground. We have given away our attachment to continuity of care, despite it being proven to improve patient outcomes. We have given away critical thinking. We've adopted technologies and ways of working that harm the patient relationship and waste time and are overly bureaucratic and deliver extremely poor value for money. And this is part of setting up a system whereby not only do the people employed by it lose faith, but the people using it lose faith. And we are then softened up to accept more and more of private control of the NHS. So I will stop there. I could go on for hours, but I think I've given you enough to be getting on with. Thank you.
Thank you, Dr. Gill. Yes, that certainly is food for thought and a lot to be going on with. First, I'll say to Mina, has anybody messaged you? Did anyone message you during the? They didn't. Okay, so I do have a question from 2 questions, in fact, and this is obviously to Bob. And have you spoken to Mark Drayford and Nicola Sturgeon to warn them what is happening in England? And I'll just add the second one as well. Do we have legal recourse in view of the fact of the repeated promises from the Tories that no privatisation on my watch, and the fact that the public have repeatedly indicated in polls that they do want the NHS to remain public? So that's 2 questions.
Yeah, so the Scotland question, I haven't had any connections with them. I know there are some campaigners who are watching closely what happens in England. I have no doubt that the US corporations won't stop at England. They need to destroy the beverage model because it shows how bad their system is. So, England is the big nut to crack. Scotland, in terms of population, and Wales are relatively, small fry. But if you can break England, then it's easy, to spread across the border, I suspect. And there are elements of the private sector creeping in there anyway. But they did step back from this internal market business a few years ago. So it's a mixed picture in Scotland, but they're certainly at threat. What was the second question? Sorry.
Sorry, I was muted then. It was, do we have any legal recourse?
Legal recourse, yeah.
Considering we've had many promises from the Tories, such as no privatisation on my watch, and of course the public repeatedly saying polls that they wish the NHS to remain in public hands. Yeah,
so I'm not a lawyer. I hope there is legal recourse. Politicians and promises, we should all be grown up enough to know how valid they are. We have a system of government where an elected cabinet and elected prime minister can carry out policy that can predictably lead to the preventable death of over 100,000 people. That's where we are at the moment. These people should be locked up. Yeah, they should be facing gross negligence manslaughter charges. But unfortunately, they write the laws and they control the implementation of law. Now, if you look at the case of Julian Assange, now, if anybody tries to argue with me that there hasn't been any political interference with the judicial system, which ensures he's locked up, languishing, being tortured in Belmarsh, then I think they need to stop reading fairy stories, you know? So we have a deeply broken democratic system whereby people can lie to get into office, lie when they're in office, and face uh, no sort of sanction. In fact, there is one thing I'm aware of, which is called Crown indemnity. So if a politician commits a criminal offence or an unlawful act in the pursuit of policy whilst in government, they are immune from prosecution. Now, I think that needs to change. I think we need to also have laws in place, or enforce laws if they are in place, against bribery and corruption. To have a VIP lane where you're 10 times more likely to get a contract, a government contract behind closed doors, if you have links to the Conservative Party. Why is that not being prosecuted for corruption? I don't understand. So, you know, there are so many crimes being committed, but there's no accountability at the moment. So we have a big hole in our democracy. The functioning of our democracy, the picture we're presented on mainstream news does not represent the reality. Let's not forget we conducted an illegal war against Iraq, which is estimated to have cost 1 million lives. I'm still waiting for anybody to be jailed for that.
Absolutely. Well, if anybody else has any questions or points to raise, you could message. Oh, I see. Marine has her hands up. Marine, have you got a question?
Just kind of in terms of like practical next steps, do you have any suggestions on what people could or should be doing? Obviously, listening to this and having seen the film, I think we all feel pretty angry and pretty powerless. Is there anything we can do other than leave the country?
Yeah, you'll be struggling to find a place where this isn't happening at some level. So you're probably better off staying here and fighting. Our biggest obstacle is awareness, and you know, as many people as possible need to first of all get their head around what's going on, convince themselves it is going on, and then think of ways of amplifying the message. So you know, I have personally spoken, or people have heard, tens of thousands of people have heard what I've had to say. Yeah. Now, I'm not saying everybody needs to get to that a target, but we could all pick up the phone and ring LBC, ring talk radio, and challenge the lies that are being spun to create a dominant narrative that the NHS is failing and it's a system we need to abandon. That happens every time I switch on the radio. Now, I wish I could ring up every time I hear this nonsense, but if enough of us equip ourselves to challenge the narrative, because control in this country is not achieved through the end of a gun, as in a military dictatorship. It's achieved through propaganda and brainwashing, and that happens through national TV and radio stations. So we need to develop an army of people who counteract the lies. That's the first thing. The truth should be easier to sell than a lie, because the lies can easily be undone. So, you know, we have the truth on our side. We have a sense of fairness on our side. Nobody likes criminality. Nobody likes corruption. Nobody likes to be lied to. Nobody likes to be conned. And most of all, nobody wants to lose a loved one or risk serious harm or death to themselves. So the motivation for our side should be very strong. People need to feel empowered. It doesn't take the whole population to wake up to change the course of history. There's a critical mass of 5 to 10% of the population, probably even less actually, to become coordinated and effective and make change happen. That's how changes happen throughout history. Women's suffrage, equal rights, any improvement in life has been achieved from the bottom up by a small percentage of committed, well-informed, courageous people. The reason I do these meetings, I'm trying to identify them and get them motivated to do something. There is a growing awareness. I wrote something for a magazine called Consortium News, which managed to get shared so far on Twitter over 3,000 times. There's a group, if you want to join a group or look into a group, there's a group called Every Doctor, who seem to be very well organized, very competent, and have achieved significant traction and are sincere. The other thing to look out for, you should know as Greens, is this greenwashing business, where people from the other side pretend to be green and control the messaging. Well, that's also happening in NHS campaigning. So the way to tell whether anybody knows what they're talking about is whether they mention American insurance industry taking over the NHS. If they don't mention that, that's the elephant in the room. You need to start smelling a rat. So yes, we can do something. We can spread the information. We need to take a leaf out of the book of organizations and campaigns like Black Lives Matter and Extinction Rebellion. I think the time for quiet discourse is gone. We need to be thinking into direct action. One action could be, for example, quite simple: go and peacefully leaflet the surgery of somebody who's sitting on a board, on a clinical commissioning board. We need to put heat on the individuals who are selling us out. And we need to put heat on the organizations that are selling us out. If you're a member of a union interested in health, Unison, GMB, Unite, the BMA, the RCN, what are they doing? Why aren't they telling you about this? Members of organizations need to be demanding more of their leaderships. Now, currently, we have a shadow cabinet, which is totally next to useless. We have a government which is, we have an opposition which for a brief while you could describe as socially democratic, but now it has distinctly reverted to neoliberal. They are not fighting for the NHS. What we see is performative theatre in Parliament. The shadow team, I've not heard anything reassuring coming from the mouth of John Ashworth. He talks about not wanting Virgin on the boards of these ICSs. Well, he should be calling for ICSs never to materialize. He should be telling us about Simon Stevens and United Health taking over the budgets, but he isn't. So they're quite happy, I'm afraid, for this to go through. And don't forget, they had a significant hand in handing Boris Johnson his 80 MP majority through their sabotage of the efforts of the Corbyn leadership. So pressure on groups, pressure on our leaders, inform yourself, get out there on social media, get out there on radio, tell as many people as you know, get informed, watch Sicko. If you haven't watched Michael Moore's film Sicko, please watch it, because that's where we're going. That is our Christmas future. Tell everybody else to watch it. If you know, set up little groups yourselves and consider organizing a screening of my film. I'm happy to come and do a Q&A if we ever get to meet in person. Keep spreading the word. I can't, even when I try and take a break, I see the impact. A patient walks in and tells me some devastating story about failed care. I can't switch off, I'm afraid. I've tried. So I'm going to carry on doing this as long as I have the energy and the backing of my very patient family. I will carry on doing it. I'm not going to let them get away with this and walk all over us. And the system they have in place I can't work in.
Dr. Bob, I have a question from Jay, and she says, does the Labour Party and the Lib Dems, etc., know that this is happening? Tories have effectively been in power since 2010, which ties in with the timeline that you have said, that this had become much worse.
Yeah, so there is absolutely no excuse for the Labour Party or the Liberal Democrats not to know what's going on. They have been part of what's going on. New Labour spent 13 years doing exactly what we're seeing unfolding now. They saddled the NHS with PFI debt. They further entrenched the internal market. They, for the first time in the history of the NHS, outsourced clinical services. They introduced the toxic GP contract, which has allowed private companies to come in. They are guilty. Their hands are covered. You know, there's nowhere for them to hide on this. It was only for the brief period Corbyn was in office as leader of the Labour Party that we heard any of them utter the word privatisation of the NHS. Now, nobody's that stupid. Nobody's that incompetent. The Liberal Democrats, let's not forget, were the enablers of the Health and Social Care Act 2012. They were in coalition with the government, and the recently deceased Shirley Williams was instrumental in making sure that the legislation got through the House of Lords. They have nowhere to hide on this, I'm afraid. And, you know, whether they understand the extent of the harm they're doing, that's a different matter, because they will have been skillfully brainwashed into thinking somehow this is an improvement. Yeah, or they're so blinded by personal ambition and greed that they can't think rationally anymore.
Thank you. Our next question comes from Kate, Dr. Kate, of our Ealing Greens, and she asks, how would you counter the well-being or resilience narrative that is being spun, that Dr. Crosland herself finds so frustrating? Any tips for how to discuss this with NHS colleagues without being accused of being too political?
Okay, so those colleagues who don't realize healthcare is political, you know, I despair. I can't think of any aspect of life which is not political. You know, most of my surgery time is dealing with the fallout of political decisions, be it stress because of work exploitation, be it stress because of lack of money, be it stress because they're being bullied. You know, every aspect of life is touched by political decisions, and so is the NHS. The NHS is deeply political. The decision to provide universal comprehensive health care paid by taxation is deeply political. So there's no escaping that. The whole agenda behind self-care, resilience, telling people to go and not bother their doctor. Now that might seem superficially attractive. That reinforces a narrative that there's a lot of inappropriate health-seeking behavior, but it also achieves a very important thing. It offloads the responsibility of government and society for the health and well-being of each other and puts it on the individual and blames the individual. Well, no, you're not resilient enough, are you? That's why you're the way you are. So this is called nudging. Nudging is a psychological technique whereby you message, neuro-linguistic programming, brainwashing, call it what you like, but it's very deliberate. And, you know, as a doctor, as a health professional, we have to, it's compulsory for us to endure endless meetings. I'll give you an example. Safeguarding of adults, safeguarding of children. They are very important topics. But if our government is introducing policies which impoverish and make people's lives hell, which increase the risk of there being a safeguarding issue. Well, I'm sorry, this is gaslighting. Your policies are causing the exact problems you are pretending to educate and raise our awareness about. This is duplicitous. This is playing with our heads. And, you know, another example of what they're trying to do, they need to double down on divide and rule. They've picked Muslims as a target group. They want to create as much racial disharmony as possible. So whilst we're busy blaming each other at the bottom of the pile, they can continue unhindered with looting the state and enabling the wealth of this country to be extracted for foreign corporations who won't pay any tax. So it's central to their policy for us to blame immigrants, for us to blame brown people, so they can introduce a charging system, which they've already done, which will be expanded to the point of universality. Blame the individual, transfer responsibility on the individual, and divide people up against each other.
Yeah, we blame the individual narrative. We see so many in so many areas, including, of course, climate change, the reasons for climate change. But yeah, we've got another question. This is from Caroline, who also asked a question earlier. And let's say the hopefully thinkable happens and the Green Party surge into government at the next election. Obviously, one of our top priorities would be to return NHS fully to public hands. But what would be the nuts and bolts about how to go? How would we have to actually go about doing that? Would there be any problems, etc.?
Yeah. So again, I'm not a lawyer, but I think there are things that need to be done in sequence. First of all, you need to stop any asset stripping. You need to stop any sales of hospital land and buildings. You need to block any duplication, copying of patient data. You need to stem the flow of money out of the NHS. Any legislation doesn't have to be complicated. You can write a relatively straightforward bill, as was the 1948 bill, a very slim bill, which said all these assets are going to be returned to public ownership, and it will be publicly run, publicly provided, and publicly funded. And it will supersede a lot of what's gone on before. In terms of private finance initiative, there is a suspicion that a lot of these contracts were fraudulently derived. So the Green Party mustn't call for paying off the financiers 100% of what they're owed. No, we need to be looking at these contracts very closely and pursuing them for fraud and corruption. We need to use the law to chase off these corporate raiders wherever possible. So a renationalization, a bill that undoes the damage not only of the current bill, but the 2012 Act, the 2006 Act, and all the privatization acts that preceded it. We need to get to a situation where we're replicating the 1948 Act, which was very simple and said that healthcare would be provided, that's the key thing, must be provided by public employees, not private employees. And you know, you can't go wrong if you keep it simple like that.
Great, thank you. So, okay, so we've got a question from Mina. And so what percentage of the NHS, I suppose if the complete nightmare scenario is we completely arrive at an American solution, an American health system, what percentage of the way are there? What percentage of the way to that nightmare are we, would you say now?
You might not like the answer to this, but I would say 95%. Because the legislation follows on from what they've been doing for decades. It just formalizes it. So, you know, if we do not manage to stop this bill from becoming law, it will become ludicrously difficult and expensive to wrench these corporations' hands off the controls of the NHS budget. So, you know, tying that in with an international trade deal with America, it may get very, very difficult. So time is short. You know, Donald Trump, for all his many flaws, he was honest. He took the mask off the American democracy and said quite clearly, we're coming for your assets. And the NHS is one of them we're very interested in. And we want you to remove your regulation that prevents our pharmaceutical company ripping off your state and ripping off patients. So they want full deregulation and the full ability to exploit this country without any hindrance whatsoever.
Okay, question from myself. We now know that our data is at risk of being sold to whoever they decide to sell to. So my question is, what recourse do we have to protect our personal data? And can we possibly use GDPR regulations to aid that protection?
Yeah, so on an individual level, first thing that everybody should be doing is filling out a form that registers your desire not to have your personal, intimate medical details that you told in confidence to your GP being copied and put in a separate data bank to be exploited commercially. That's the first thing you should do. I've managed to get around 10% of my patients to do that. You know, you've got to ask yourself, when GPs have never been so busy, to sneak this through and make it so laborious with absolutely zero publicity. They were trying to pull off a fast one. So, you know, there's been a delay. Individuals need to act. In terms of regulation, you know, you can have all the laws and regulation you like, but if the bodies you create can be politically controlled or rendered toothless because of lack of money, then it becomes a bit of a farce. So we have to, you know, do what we can. I do know there's a law firm that are looking into the data protection elements of this. And if you want to find out more about it, look on the website for Med Confidential. And I think the law firm is Foxglove, who are exploring legal action along these grounds. So I'm sure they could do with some support.
Okay, so that's Med Confidential, everyone. Look up that. I think that's be some useful information for us all. So, okay, so we're an hour and 5 minutes into it. Does anybody have any further questions, or shall we call that an evening? It looks like.
I think I need a drink.
Sorry. Okay. Oh, do we have a question from Mina? Okay, over to you, Mina.
Not me, Jay. It's Jay again.
Apologies.
She says, how can we stop the bill from becoming law when so many are not even aware of it? What is the bill called again? Would gov.uk petition be useful?
Okay, so what I'll send to the group is that article that I wrote, which has all the links in it. So you can find the bill, you can find the white paper it was based on. Certainly it's worth talking to your sort of elected representatives to find out what they're doing about it. You know, it's getting to the point, because the government have got such a majority, the parliamentary route is shut to us. We have to think of another way of stopping this, you know, whether it be mass civil disobedience, whether it be a general strike, because it's getting to the point nothing else will work. And, you know, the only way we'll get support for those type of action is by getting the word out. And it's down to us, you know, it's down to people in groups like this making a commitment to do that, you know, because we're not going to hear this on the BBC, I'm afraid.
Just going to ask to Jackie's got her hand up. Have you got a question, Jackie?
I just wanted to express my sincere thanks to Bob for all his hard work and his colleagues like Colin, who are helping to get these messages out. And I know, Bob, you've been working hard on this for years and it must take its toll. But we really do appreciate everything that you're doing.
Thank you very much.
Mina?
There's a question from Nigel. He asked, are our GPs aware of these practices?
I'm afraid the sort of mental state of doctors that I've spoken to is to close their eyes and cover their ears. They are so overwhelmed that they just don't want to hear anything. And, you know, it's quite tragic. And a lot of them have lost the ability of critical thinking, I'm afraid, because they should be able to smell the roses, you know. Service after service has got worse and worse and worse, harder to access, and being provided by the private sector. You would have thought they might guess that their own job is going to go that way, but they don't seem to be. They've swallowed, unfortunately, my union, the British Medical Association, is 100%, the leadership is 100% complicit with what's going on. And they have ensured a state of ignorance amongst the profession by totally misleading them. And the most recent and most horrendous example was the 2019 new primary care network contract, which was sold to the GPs as just an extra pocket of cash. But in reality, it's a parallel contract which will suffocate and snuff out their existing contracts. And it's a mechanism of taking control of GPs' patient lists and with them their budgets. So GPs will lose autonomy, and the doctors that will be remaining within the NHS, or what's called the NHS, will be employees of the integrated care system. They will have no autonomy, no continuity, next to zero satisfaction, dealing with very disgruntled patients all day long. And they will be replaced, a lot of them. They will be replaced by the receptionist, who will be empowered to make a diagnosis and decide whether you need treatment or not, physiotherapists and pharmacists. Yeah? They're trying to get rid of doctors. In fact, if you read their documentation, the idea of a patient seeing a doctor face to face is considered a legacy system, something they want to remove. And, you know, they've fallen over themselves to adopt telehealth and telemedicine and practice by cutting corners. It's tragic, it's embarrassing, it's ultimately suicidal for the profession.
Kate's got her hand up, Jeremy.
I was about to say Kate's got a hand up. Kate, do you want to tell us your question?
Hi, I was just going to thank Bob and echo his comments that most of the senior leaders I've worked with in the NHS are so busy writing business cases and energy efficiency plans and things that they don't really have the headspace to think about why they're doing that. And also, I think the majority of my colleagues are by now so burnt out that the attitude is just, tell me what you want me to do and I'll do it. And I don't really have the energy to argue with you about why that's a terrible idea. And I think the pandemic is massively increasing that. So yeah, we need help from outside to do this because there's not a lot of energy left inside to do it.
Yeah, the profession is on the ropes. We're like the battered spouse. You know, we keep taking the abuse and hope that the system will reform itself. It's not going to happen, and we're so battered down we can't even resist anymore. One of the driving factors for me is I know what awaits the junior doctors that are in training now. And you know, I've been a doctor long enough to remember the NHS how it used to be, how it was a cohesive system, lots of camaraderie, good morale. Although it was underfunded, at least we were proud of the job we were able to deliver. But that's gone. And we're firefighting constantly. We're delivering substandard care, and we're increasingly having to tell our patients, sorry, you'll be waiting a long time, or that's no longer available, or can you go to Specsavers or go to the pharmacist, who have a financial interest. They have a huge conflict of interest. If you go and see the pharmacist for something that doesn't need treatment, they're going to be selling you some treatment. That was the beauty of the NHS. The relationship with the patient and the doctor was unfettered with financial exchange. We were paid by the government, we were paid by the state. The more financial incentives you introduce, the more you pervert the relationship and you create perverse incentives to act against the patient's interests. And I'm not prepared to go there.
Nick, you've got your hand up.
I don't want to stop anybody asking questions, but I think we could go on asking questions all evening if we weren't careful. And I'm sort of mindful that Bob's time is really valuable. I would suggest that having heard all of this, we've got more than enough to go away with and sort of think about and talk about. And presumably we could always come back to Bob or one of his colleagues if we had further key questions that we realised we hadn't covered tonight. Anyway, just a suggestion that we sort of finish fairly soon.
That's absolutely fine. I'm going to stop recording.